Last week, Betsy McCaughey, former Lieutenant Governor of New York and creator of the bogus death panel rumor that claimed health reform would lead to euthanasia of frail elderly, came apart at the seams in front of a nationwide audience. Brandishing one of two large volumes she identified as the Congressional Health Reform Bill currently being debated, she was unable to find the reference that she herself referred to as support for her claims. A bit about Betsy. She's against a federal council for comparative effectiveness research that would study and compare evidence and outcomes to support future health planning decisions. Her argument? The group would use a method, quotes, that divides the cost of the treatment by the number of years the patient is likely to benefit. Treatments for younger patients are more often approved than treatments for diseases that affect the elderly, and therefore would make it mandatory that people on Medicare be told how to end their lives sooner, close quotes. According to Betsy, such protocols would lead to, quotes, euthanasia for the elderly, close quotes. Now, as Betsy, a PhD in history, made her unsubstantiated pronouncements, a wide range of others supplied a now familiar echo chamber. The wheels only finally came off her bus when she was challenged by John Stewart of Comedy Central. While she stuttered and stumbled, a group of real experts continued to struggle quietly to steer our nation's health system toward an endpoint that would simultaneously increase quality while better managing cost. They're working diligently to design a system that would advantage what we know for certain, commonly termed evidence, and apply it to healthcare practice nationwide consistently and without wide variability from one location to another. The truth is that evidence-based medicine, as it's called, is a powerful tool that holds great promise if used properly. It's been defined as the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. It has the potential to enhance the patient-physician relationships and improve patient care. This week's health commentary transcript provides a brief history of evidence-based medicine and helps clarify its potential. That review includes an analysis of David Sackett's classic article titled Evidence-Based Medicine, What It Is and What It Isn't, from 1996. In that article, he clearly describes that when used correctly, evidence-based medicine incorporates evidence, physician expertise, and the patient's values. In his words, quotes, good doctors use both individual clinical expertise and the best available external evidence, and neither alone is enough. Without clinical expertise, practice risks becoming tyrannized by evidence, for even excellent external evidence may be inapplicable or inappropriate for an individual patient. Without current best evidence, practice risks becoming rapidly out of date to the detriment of patients. For Health Commentary, I'm Magee.